Over to you, Michael and Linda.
Thank you so much. Good afternoon, everyone, and good morning to some of you. Welcome to today's session. My name is Linda Piri. I am the Executive Director of the Grassroots Women-led organization called Girl Power for Change. I am also the country steering committee member for United Movement, and I sit in the CCM as the Youth and AGYW representative. So with me, I'll be moderating this session with Michael, and I think I should give the floor to Michael to introduce himself. Over to you, Mike.
Thank you so much, Linda. Good morning, good afternoon, good evening, depending on your time zone. My name is Michael Senyonga. I hail from Uganda in a rural village called Kasese. I am a CCM board member representing the youth at the Global Fund CCM board. I am also a member of the Program Development and Resource Mobilization Committee of the Global Fund. And I'm glad to be co-hosting together with Linda. Looking forward to a wonderful conversation today. Over to you, Linda, please.
Thank you so much, Michael. So I think before we move on, I would like to just give a brief overview of what United Movement is all about before I call upon Faith to also elaborate on it more. So United Movement is a regional movement of young people in the East and Southern Africa. The movement solely focuses on advocating for issues that young people are facing in areas of HIV, SRHR, and United Movement also has got 147 youth-led organization in the Eastern and Southern Africa. So, Faith, can we go to the other slide? So, United Movement is convened by Y Plus Global. I think some of us have heard of it, and Afri and ISA. It's also supported by UNICEF, UNFPA, and UNAIDS as part of the Together for SRHR program. And as I've said, that United Movement is a Eastern and Southern Africa, is a movement based in the Eastern and Southern Africa, and these are some of the countries that United Movement is in. Also on the screen, I'll just mention a few. There's Kenya, there's Lesotho, there's Mozambique, there's Rwanda, there's Tanzania, and whatnot. In the year 2025, United Movement managed to register 700 active members by 2025, and you can see that it's a very active movement. So before we proceed, I would like to hand it over to Faith. She is going to introduce herself, but also she's also going to give the welcoming remarks, and she's also going to tell us why we're here. Over to you, Faith.
Thank you, Linda. And good afternoon, everyone. My name is Faith Tipe, and I'm the United Movement Program Officer with the Global Network of Young People Living with HIV. That is Y Plus Global. And I'm excited to see many of you here, and we're hoping for fruitful conversations. Mine is just to welcome you into this particular space that we have created. As United Movement, we have taken opportunity to create space for young people to engage in the Global Fund processes in various ways. For the longest time, we've been hearing about Global Fund processes, hearing about the country coordinating mechanisms in our countries, and we don't necessarily know how then we engage in those processes or who we have to link with for us to be able to engage in the Global Fund processes. And today we are starting something that would be not for the first time and not for the last time, and we are hoping that this kind of engagements will continue. And won't just be for feedback sessions of people who have attended certain meetings and coming back to feedback to us what was discussed there, but also an opportunity for young people to feed into the different grant applications at country level through your CCM representatives whom are present in this call today. If you look through the list of participants, you'd find that they have renamed their names according to their countries and CCM rep positions in the different CCM mechanisms. And I don't want to preempt what the next speaker would speak to, but this particular call came after a meeting that was held in Rwanda last month, which brought together CCM representatives and civil society organizations to engage on meaningful engagement in Global Fund Grand Cycle 8 preparations, etc. And we are hoping that by the end of this call, we'll have sort of like an action item moving forward of how, as young people in East and Southern Africa region, we are going to utilize and leverage this platform that we are trying to create for ourselves to influence the Grand Cycle 8 processes, keeping in mind that the Global Fund we underwent the replenishment and it wasn't fully replenished to the target that was set. So now we are required to do more with less. Um, the global health landscape has shifted, and the pressure and the tone that is being used on equity, gender, and human rights is so much, and we need really to ensure that we speak up and we ensure that our priorities are not left behind in those grant applications at country level, and other opportunities that would come through. Thank you, and over to you, Linda.
Thank you so much, Faith, for articulating our today's agenda really well. And also, just to add on what Faith has said, the reason why we're having this feedback session today is that we want to be in the on the same page, since soon we'll be writing proposals for the GC8. So for now, I think we can start. I would like to call upon Lisa. She is going to introduce herself, but also she's going to give us the overview. Over to you, Faye. Over to you, Lisa.
Okay, thank you so much, Linda. Thank you, the United Movement and Y Plus Global for providing us with this opportunity to share, like a brief recap of what took place in the meeting. My name is Lisa Marianne. I am the Anglophone Africa Regional Learning Hub Coordinator. We are part of 6 learning hubs by the Global Fund across the globe. And one of our roles, or rather our key roles, is to disseminate Global Fund information to communities, translate it in languages, and simplify it in a manner that's palatable for communities to be able to understand and utilize these messages in their advocacy initiatives at country levels, but also we broker technical assistance and small grants to increase the capacity of communities to be able to engage in national policy processes, as well as global fund implementation cycles, and also support communities with small grants to be able to organize themselves at country level for advocacy purposes. So maybe just to quickly give a recap of the meeting that Faith has spoken about. So we did host a meeting last month in Kigali, Rwanda, and this meeting brought different civil societies across the Anglophone region, as well as members of CCMs in the region, including young people, KPs, and representatives of the 3 disease areas, that's HIV, TB, and malaria. And the goal of this meeting was to support communities and increase their agency when it comes to their meaningful engagement in the GC8 processes. So it was a very interactive 3 days whereby we had also technical partners on board, such as UNAIDS, who is also on this call, Stop TB Partnership, the Data Hub, who are also on this call, and among many other technical partners, as well as community members, as I have shared. So a lot happened, but just to summarize so that I don't take so much of your time, is that the key objectives of the meeting was to strengthen community and civil society understanding of the GC8 architecture. So if you have all been attending some of the webinars by Global Fund, you have noticed that there have been some critical changes when you compare the outline of GC7 and what GC8 would look like, as well as the available resources. So it was also to support our communities to be able to understand that and provide learning materials and resources that they can go back and use to cascade at their national level. Then it was also an opportunity for peer learning across countries, just reflecting upon how GC7 implementation has been, how reprioritization affected implementation, and what to look out for in terms of what are community priorities that we need to make sure we safeguard in GC8. And last but not least was also to ensure that we strengthen the capacity of our communities and CCM to be able to understand why protecting human rights and gender when it comes to GC8 programming is essential. And then some of the key areas of discussions, and I know some of the panelists here are going to speak about them in summary.
The one who called you yesterday.
Yeah,
I said I'm joining with me. So put in the chat box and said, put my name is
Please, Mpumalanga, mute.
Yes, please. Okay. I hope I'm audible. So just quickly, so that I don't take so much time, some of the key areas that were discussed or that communities and civil societies were really interested in, outside of the guidance that Global Fund provided, was issues around integration of services. And this is a hot topic that communities want not only to be able to understand, but they want to know how GC8 will play out when it comes to integration and how key services and priority issues are going to be protected, especially those that touch on human rights when it comes to integration of services around HIV, TB, and malaria. Something else that really stood out, or a conversation that was a hot topic, was on transition and sustainability. We do realize that there are countries that are currently going through a transition in GC8. It might be their last support that they get from Global Fund, but also the issue around sustainability is very interesting, because whether your country is in line for transition or not, sustainability is something that we all need to be thinking about. And also integration in one way or another intersects the conversation around sustainability. How do we advocate for increased domestic resources at national level so that services are protected and the quality is still maintained, whether we have resources or not, and also not just thinking about Global Fund being supporting communities, but also the shrinking civic space in general. Also around documenting community priorities, but also through the data that community is collecting. How do we get to interpret this data? How do we get to utilize this data? And because this meeting had representatives from CCMs across Anglophone Africa, it was also important to reinforce the role of CCMs when it comes to advocacy, when it comes to leading national processes in the different countries, but also safeguarding their inclusive participation and increasing their voice and agency when it comes to influencing funding requests specifically for GC8, but also supporting their primary recipients and SRs when it comes to strengthening oversight once the grant implementation begins, but also it was important for communities to be able to understand the GC8 playbook, what are some of the things that need to be considered, the key timelines, how to mobilize at national level, and most important, soon by next. And here to be able to cascade it, that you're able to reference it even when you're engaging with GC8 processes.
Excuse me, Lisa, we lost you. I think she's having a bad network. Lisa, we can't hear you.
Probably we lost her.
I also can't hear her.
Yes, we've lost her, but I think when she's back, she will continue from where she stopped. So I just wanted to inform us that we can also continue introducing ourselves in the chat box. We need to know each other. We need to know people that are here as we're waiting for Lisa. But also as she's presenting, let us take note that if you have any question or a comment, please write it somewhere because the time for question and answer will also come. Lisa, we've lost her. So I think when she comes, we will continue. For now, I would like to give the floor to Rahim. Rahim, you're here, yeah? Rahim. Okay, maybe it's the network issue. Ishmael, can you come in? And then after that, if Lisa tends to come in, she'll wait, and then we'll have Lisa. Ishmael, it's your turn. Over to you.
All right. Thank you so much. I hope you are able to hear me. Can you please confirm?
Yes. Please go on.
All right. It's actually quite unfortunate that we don't have Rahim online, but
I'm
yes,
here.
is that Rahim?
Ishmael. Yes. Hi,
All right.
Ishmael.
So as I was saying that we should actually have Rahim's presentation first before sustainability, because in that way we are going to have the connectivity of what we are actually talking about. So over to you, Rahim, before I can actually come in. Thank you.
Thank you. Hi and hello to everyone. Good morning, good afternoon, and so I'm here to share the view on community-led monitoring as is shown in the screen. My names are Rahim Nasser. Fortunately have been privileged.
Rahim, we can't hear you properly. You're tripping. Rahim, we can't hear you. You're tripping.
The CC country connecting. Am I audible now?
Yes. Please, you can, I think, start all over again.
Sorry. Okay. As I was saying, my name is Rahim Nasa from Tanzania. I was representing young people, meeting mechanism, CCM. And right now we have two new representatives who we will be meeting going forward. My tenure ended at February, but I'm still a young and vibrant youth stakeholder in the country who is um the HIV response. So I will also to share on the issues of you can use data to influence Global Fund Cycle 8 and how we can link community-led monitoring and youth engagement. So as it seems, we want to understand why data matters for communities in GC8. In Grant Cycle 8, the Global Fund to fight HIV, TB, and malaria in countries are expected to demonstrate impact, efficiency, and accountability. This is why we need to have data backing our interventions. And community influence national policies by providing evidence from the ground through community-led monitoring. So the CLM can generate real-time data on service availability and quality, you see medicines and diagnostic stockouts, stigma and discrimination in health facilities, and barriers that are facing people, AGYW, ABYM, and key and vulnerable population as well. So this evidence implement the national program data and to implement that data and ensure that the realities are reflected in decision making. So community-led monitoring, how can we use it as a data source? You see, CLM allows communities to systematically collect and analyze information about health services. For example, CLM data includes waiting time at clinics, availability of HIV service, um, and it accounts experiences of stigma or discriminations and accessibility of youth-friendly services, for young people. So when presented in CCM's discussions or grant reviews and program design progress, this data can influence resource allocation. As we know, for community activities, if we want to have this resource allocation, we need to provide activity that can be supported or can be costed. And for activity to be costed, then it needs to be data that this activity is relevant. So we see the service delivery models, see reforms. CLM can be used in this in multiple angle, and therefore it can strengthen community accountability, transparency in global fund grants. In matters or how we can use CLM need also to see the roles of young people in data collection and analysis. Young people are uniquely positioned to support them because they are digitally skilled, close to affected community, and able to reach young population, often, excluded from traditional systems. And youth can contribute by collecting data using mobile tools or digital surveys, conducting peer-to-peer interviews, and monitoring youth-friendly services. They can also interpret by identifying trend of affecting young people and analyzing barriers to accessing services. Young people are active, and young advocates can further communicate findings by translating data into simple advocacy messages. Having report, uh, simplified report that can be understood and shared using social medias and youth network like this United Movement we have, so that can amplify the evidence collected. And this can ensure the voices and realities of young people are reflected in GC8 programming. And when we have all this collected, data become an influence to the decisions in GC8. And communities can use CLM data to advocate for better resource allocation, as I mentioned, because you already have evidence and saying the intervention can be supported or can work, then they can be allocated some resources to work, even when we are heading towards sustainability and depending on our governments to facilitate community activities in some countries, particularly where evidence shown gaps such as lack of services for young people, key vulnerable population, or shortage of medicines, inadequate for youth-friendly services, then all of this can be, formed in a way of evidence so that it can be shared as an intervention to be funded in our priorities. Data can also highlight quality assurance such as discrimination in facilities, long waiting times, or poor services delivery. And this evidence can drive improvement in program implementation within Global Fund programs. And this is how we use CLM. And community-generated data can strengthen accountability by helping community monitor whether community mandates in grants are actually implemented. So, when we had GC7, now we are able to follow what intervention which were approved in implementation. Was they implemented as it were written? And how can we follow to ensure that they are honored in GC8? So how can community work together? It's another uh, another aspect where we can look on, especially for young people, so that we can be able to maximize the impact of data in GC8. I believe that communities should strengthen CLM system by training community monitors, standardizing data collection tools. And while I've seen the importance of this meeting, for example, where we learn from each other of the activities or interventions that are working in Malawi, in Kenya, in Uganda for young people, and how can we be able to the standardizing data for tracking, saying that this activity it can work. It can work since it works in Malawi, it can also work in Tanzania, for instance. When we're in Rwanda, one activity which was implemented for KVP in Kenya was it paralegal, empowering paralegal so that they can be able to, the KVP should be able to get services. I mean, if they think that law is somewhat against them, then these paralegals can step in and assist the KVPs. So I thought that activity, this intervention can work in Tanzania. So where are the platforms like those where we can learn these practical activities and we can be able to adapt them in our countries as well, especially for young people. And because young people are similar, of course they are not same, but similar. Some, when you learn the interventional issues, you find that some Malawi youth, it's same of the issues facing Tanzanian young people as well. So what we learn from each other, and how can we standardize each one of us? And therefore, I think we should also engage youth network by integrating young people as community, build youth data literacy skills. how can we use this CLM on all these resources we have, however small, maximize it so that they can assist us as young people in HIV response or in Global Fund programming in general. So area of data literacy, building data literacy skills for young people, it can assist in sharing evidence widely in our CCM meetings, policy dialogues, advocacy platforms, and help ensure that community data inform decision, especially for young people. And should also build partnership with civil society organizations, community research institutions, community network to strengthen evidence generated and advocacy.
Rahim, we can't hear you, but I think you're remaining with 2 minutes, so that we should go to another speaker. Rahim?
As to wind up, to speak. Am I audible?
Of course, we lost you, but I think now you're audible. Please go on.
Yes, you are audible.
Okay. Well, I was finalizing by saying data collected through community-led monitoring, especially when driven by young people, can transform community experiences in that shapes stories. Finding decision, finding decisions and accountability.
Rahim, we can't hear you again. I think you are having network.
We were able from this. Yeah, think I think my network is kind of weak. Hello.
Please go on. Yes, we can hear you now.
Now, okay. So let me wind up by saying data collected through, especially when driven by young people, can transform community experiences into evidence that shapes GC8 priorities, funding decision, and accountability. And we can be able to, from the meeting we had in Rwanda, we were able to learn how to approach Ministry of Health, how we can collaborate with our colleagues at civil society platform. And I believe by investing in youth engagement through community data system, will help ensure that Global Fund programs respond to real community needs and everyone, especially young people, are meaningfully engaged. Thank you for having me, and thank you for this moment. Asante sana. Karibuni Tanzania.
Thank you so much, Rahim, for articulating really well the issues around community-led monitoring. And to be honest, for those that sit in the CCM, it's very important, but also you can agree with me that having data, but also evidence-based data is very important in as far as decision-making in the CCM is concerned. So before we go back to Ishmael, I would like to give the floor to Lisa. I think, Lisa, we lost you because of network. And colleagues, please bear with us. You know, network sometimes it trips a lot, but hopefully it won't again. So Lisa, over to you. Please make sure that all of us, please let us make sure that we're keeping time so that we should manage to tackle everything that we planned. Over to you, Lisa. Lisa, are you there? Okay. Ishmael, please come in, but also let's keep time. We all know the allocated time, so let us make sure that we don't talk too much, but rather we are simple and straightforward to the points. You know, it's weekend. Over to you, Ishmael.
It's quite unfortunate that the issue about talking too much is actually coming from you, Linda. When you personally know that the person who is actually speaking next is Ishmael Sibonda Piri from Malawi. All right. Hi, everyone. Once again, I'm Ishmael Piri from Malawi. It's actually stated on the flyer that inside the presentation that I'm a CCM Youth Representative from Malawi, but I should make it actually clear that I'm actually representing the PRHIV constituency. But because I'm a young person, really issues that concerns young people and HYW do concern me, and I also have a say and a vote. And of course, another hat which I actually wear, which most of you people don't actually know, is the KP hat. So yeah, wearing those three hats, I'm here to present about sustainability, transition, and planning. As the discussions that we are actually having last month in Kigali, Rwanda, the issues about sustainability, transition, and planning also came out stronger and came out as an eye opener in as far as support is actually concerned. For the past years, I think 2 or 3 years, we've been talking about sustainability. We've been talking about transition. Why are we talking about sustainability? It's because we should understand that the support which we actually get from donors and funders is not going to be there forever. We should understand as young people that Global Fund, in as far as we are talking about the shrinking envelope of shrinking budgets and other countries being transitioned from receiving the Global Fund, it just indicates that the support which we actually have now is not going to be there forever. So, what should we do as young people? What should we do as civil society organizations to make sure that we are sustaining the gains that we have actually acquired for quite a long time? Moving forward. And also, I should emphasize that as young people, we are also at the hub of transitioning. We are at the hub of sustainability because we have seen the older generation fighting off three diseases, HIV, TB, and malaria in our countries. And by the time we are actually joining the fight, that's when the envelopes are actually getting dry. And that's when we are talking about transition. That's when we are talking about sustainability. So, what are the roles that young people should actually play in making sure that we are sustaining the gains that have been there in the fight against HIV, TB, and malaria? What are the roles that young people can actually play moving forward as we are preparing for GC8? What are the roles that we can play as young people in as far as transition is actually concerned in our countries? So we are talking about country ownership and leadership, where we should emphasize much about the need of stronger national leadership in planning, financing, and implementing programs that are supported by Global Fund. For quite a long time, the health sectors in our countries have been largely supported by donors, but our government have not been committed to make sure that those programs are being integrated in their government plans, government budgets, and government policies, because we have actually believed for quite a long time that the support is going to be there. But now that we are talking about sustainability, it's actually very important. It's actually very alarming that we should emphasize the national leadership in making sure that all these programs that are being financed by Global Fund and other partners are being integrated in government funding, planning, and budgets, so that we can actually facilitate sustainability of the gains that we have had for the past years. And of course, we can't talk about sustainability without talking about integration. For quite a long time, we've been talking about integration. How are we going to make make sure that we are integrating the services. We are integrating AGYW and youth in the programs that are run by Global Fund, in the programs that our government are actually implementing in the countries. And how is integration going to facilitate sustainability? You'd see that the programs that are actually funded under Global Fund and the ones that we are actually preparing for our priorities as young people and AGYW to be incorporated in GC8 should be integrated. We should make sure that the programs which we are actually prioritizing are integrated programs, because with the funding shrinking, we can't go on a parallel lines. We can't go on a parallel implementation, but we are making sure that we are bringing all the efforts together and using the resources that are actually available and sustaining the gains that we have actually made in the countries. So integration should make sure that is actually existing in national health systems, the policies which we actually formulate and implement, and also the strategies to avoid parallel structures, and of course the integration as well. We should actually include it within our national sexual reproductive and health, HIV, TB, and malaria programs. We should make sure that we are also speaking integration in as far as those is also concerned. And the community system strengthening as well. Rahim has talked much about CLM. CLM is also part of sustainability. You can't talk about sustainability without talking about the communities, without talking about the community structures, the community systems. The community systems are there, young people are in the communities, and they facilitate transition, they facilitate sustainability, because the community structures, if they are actually empowered, they can actually implement a lot with smaller resources, which are actually we are actually getting from the donors, which we are actually getting from the funders. So how are the community systems and strengthening going to facilitate the sustainability? The community structure should be empowered to support service delivery, accountability, and community-led monitoring. Nowadays, we are talking about CAGs. CAGs are found in the communities. We are talking about the youth structures. Youth structures are found in the communities. If we are to empower the community structures, we can easily facilitate sustainability and transition. And of course, as I'm actually winding up, we can talk about sustainability and transition without financing. If you allow me just to use your 2 minutes just to finalize my slide, we are talking about domestic resource mobilization is another angle that we can also make sure that the transition and sustainability is possible in as far as Global Fund is concerned. How are the domestic resource mobilization going to facilitate or to help sustainability? The countries should explore innovations that which we can actually get the financing mechanism and increase the budgetary allocation for health and community programs. And also, as young people, we should advocate for increased government investment in SRH and community health, in as far as community health remains the key. For quite a long time, young people have been believed to be the advocates, and we are there in the spaces where decisions are actually made. But we are not holding our countries, our government accountable to finance our own systems, to finance our own health sector. And now it is about time where we can actually project voices. Yes, we should actually project those voices to make sure that our governments are actually committed to finance our health systems. And we should actually remind them that the funding each and every time keeps on shrinking. Donald Trump has actually taken away the funding through the USAID. And now Global Fund envelope is actually getting dry, and other countries are getting transition. How are we going to sustain the gains? How are we going to facilitate the transition? The government should actually be committed to make sure that they're financing their healthy sectors. With these few points of mine, I should comment this feedback session because it has really, really empowered a lot of young people who are not able to attend the Anglophone meeting in person. But with this information that we are actually sharing, I hope it is going to empower us as young people that as we are preparing for GC8, we should be prepared, we should have our evidence, we should have our data, and we should have our sustainability roadmap back in our mind so that when we are defending our priorities in as far as youth constituency is concerned, our priorities should carry the weight and should carry all the evidence that it needs to be incorporated in the document. Thank you so much, and over to you, Linda. Thank you.
Thank you so much. Ishmael, you can talk the whole day. Thank you so much for actually articulating the points really well on sustainability, transition, and planning. Right now, I would like to give the floor to my fellow moderator. Over to you, Michael.
Thank you so much, Linda. That is exciting. And thank you, Ishmael. You really spoke out well. You spoke out your heart. And quickly, of course, now after sustainability and transitioning and planning, there should be a roadmap. Where are we? Where are we heading to? What are the available advocacy opportunities that we have as young people? Join me to welcome our next speaker, next panelist, Angela Leon from Women for Global Fund, who is going to share with us the roadmap and where we are heading next. Thank you. Over to you, Angela.
Hello, can you hear me?
Yes, we can hear you loud and clear.
Thank you. Thank you so much to all the panelists and the previous informations. I think you have covered completely on the most important parts. And just like as for the benefit of this presentation, let me kindly share my screen. Can you confirm that you can see the screen?
Yes, we can see it.
So I'm going to
And
take very few
it's still
minutes.
loading.
Is it?
Yep,
Okay.
it's there
I'm
now.
going to take very few minutes to just like share some important tools and advocacy strategies we as the youth can keep on doing to protect all the community rights and gender elements of the next grant cycle 8 funding. And just briefly, let me introduce for those who don't know, Women for Global Fund is a network of women advocates supporting Global Fund programs in more than 82 countries, and we are welcoming all the ones that want to join us in the benefit of having more gender transformative and human rights, HIV, tuberculosis, and malaria responses. And it's going strictly to the point of this conversation today. I think it's important to understand that Women for Global Fund and partners have been equipping advocates to navigate grant cycle during the times. And now we come to a very important moment in which grant cycle 8 is arriving very soon. And we have produced several guides and documents that are empowering the youth, adults and young women, and also further youth to understand how allocation cycle works. And also there are key resources to understand and navigate both grant cycle 7 and grant cycle 8, and most directing these efforts towards women and girls in order diversity to understand and put forward gender transformative components for HTM responses. So please, here we are just sharing briefly what documents can you use to understand what is new, what has changed, and where we can find important entry points for advocacy. You might find those in our social media and also web, and we are happy to share those in a further link. But just briefly showing you that also CLM, for example, documents, and we have produced more than 71 advocacy briefs and technical tools that are not only tailored to the Global Fund, but also the partnership entirely to have also a broader understanding and technical key data points about, for example, cervical cancer, HIV and mental health. We have malaria and pregnancy. We also have tuberculosis and comprehensive treatment adherence. So we have produced within these 71 advocacy tools and technical documents many topics that you might find interesting to just dig a bit more. So you don't need to produce additional data. This is my key message. My key message is that we as Women for Global Fund have lots of information gathered already with key ask and technical elements that you can use for your advocacy while navigating Grand Cycle 8 and also supporting the country dialogues. We know that these elements sometimes are hard to produce, so please feel free to just check the documents, and if there's any other further information you might need, please contact us, because we have a broad list of elements and technical notes in the very different contexts and topics that you can integrate towards HIV, tuberculosis, and malaria comprehensive responses. And also wanted to share this special document that we co-organized with ICW, TB Women, and CS for Me, which is a manifesto regarding what women and girls in diversity we need to be very conscious about, and what the priorities per each disease that through a global consultation we have reached to conduct, and also understand what are these kind of non-negotiables that we are going to push forward in the next Grand Cycle 8. So please check this document, which is also available in the website and social media from our partners, to understand also what are the consequences of the Grand Cycle 7 reprioritization and taking this to the next level of Grand Cycle 8. So the key message here is, like, if you understand what was taken out from Grand Cycle 7, please check it, analyze it, and try to push it forward for Grand Cycle 8. We don't need to kind of reinvent new information. Everything is already included in the data that we have, and I'm gonna share also afterwards some other tools that you can check for further advocacy and engagement. Here you have, for example, the last documents we have produced also in English, French, and Spanish, which is the CCM guides to become an effective and Global Fund CCM member. And this comes also for the ones who are already sitting at CCM level, but also the ones who want to engage on the CCM, meaning that there are 10 steps that we are suggesting and recommending on how to be better engaged with CCMs, understand the structure of CCMs, and have specific tips for the youth on navigating the spaces that we know and acknowledge that are complicated. And finally, we have a recopilation and also of what are the key resources for gender transformative advocacy. So in this key resources and digital dossier, you can access absolutely everything that we have produced, and we have curated also a list of the documents from our partners to be more efficient and transforming this engagement for the aid replenishment, Grand Cycle 8, gender-based violence topics. So you might find a broad range of documents that you can access to influence your data, your negotiations with CCM members, and future country dialogue that are going to arrive very soon. Just let me briefly go, because I acknowledge time is very limited. The latest thing that Women for Global Fund and partners have launched the initiative to have the Global Advocacy Data Hub, which means developing some tools and spaces for youth advocates to also navigate and understand what is happening. So thanks for the partners also for this special initiative. Let me go to the next slide quickly. And then we have, for example, in this resource, which I'm going to also share the link, 3 new resources for Grand Cycle 8 advocacy. And first one is the documented portal. Then we have the Global Fund FAQ and community guide, which you can all access to better understand some key terminology, wording, and a specific data points you can use for influencing CRG components. And then you can also access the reprioritization dashboard and fact sheets. I was indicating this before, which is very important to understand what was removed from Grand Cycle 7 to leverage and use the same evidence, wording, and documents that were already approved by Global Fund to influence the next cycle in Grand Cycle 8, especially for gender transformative components, human rights, and youth services. So kindly take a look to these documents, and please reach out to the documents portal, in which you have a complete repository, curated space for Global Fund advocacy, which you can also search country by country and in different languages. And here you have, for example, access to the allocation letters, grant budgets, transition frameworks, epidemiological data, CLM reports, and all the documents that might be very useful for you to understand and use for your advocacy efforts, creating plans for your advocacy, and also integrating all this into youth-friendly priorities that can be negotiated in the Grant Cycle 8. So please access this space is completely free. And also we are seeking for your support to understand what is more needed. So if you have comments, questions, or needs regarding the documents that are not available here, please reach out to me and the network of partners so we can better curate some other additional spaces for youth-friendly service and access to documents and information. And just quickly also going to additional resources we have for the roadmap of actions. We have developed these frequently asked question documents and community guide in which you can understand also technical terms and jargon, which is currently a challenge for the youth to understand in the new changes of the Global Fund documents. So please go to this document and check if there's anything that you might need for the explication, clarification or explanation. We have coordinated a set of FAQ that can answer majority of the questions that we have received from our partners. We understand the Global Fund might be a difficult space, so that's why we have coordinated this additional global advocacy data hub for you, the youth, and our partners to navigate this complex process with less puzzles. And as I was saying before, please also share your questions, your needs for clarification, and we will be happy to also support with all the resources. And finally, we have also created two dashboards. The first one is the reprioritization dashboard, in which you can see in detail information which activities were cut during Grant Cycle 7 reprioritization, and also this information is filtered region, country, disease, module, and intervention. So this helps quantify the data, and also you can advocate to restore and include also these essential components in the next Grant Cycle 8. Finally, wanted to indicate about the CCM dashboard, which includes all the information and contact details of CCM members, and you can access CCM's information and grant timelines, as well as budget data collected in a different disaggregator level by grant component, module, and intervention. So this dashboard displays the great absorption of information that you might need to understand and seek, so you can have better advocacy strategic plans while the country dialogues start in the next couple of weeks. So from my side, I thank you very much for the opportunity of being in this webinar together. Happy to respond to any further questions by chat or by just giving my contact details to the organizers of these amazing webinars. So thank you for the opportunity, and let's keep on advocating to find more resources, reports, guidelines that can be very useful for the youth, adults, and young women, and for all young people that are engaged in this next Grant Cycle 8 processes. Thank you, Linda, and back to you.
Thank you so much, Angela. Wow, I love it when Angela says finally more than once.
Sorry.
That's
I'm sorry.
amazing.
The very final.
Yes, but to all our young people that are on the call, please reach out to the documents portal, and more so to the CCM board members, youth representatives that are here like myself. Let's reach out to the 10-step guide of becoming an effective CCM board member, and we'll learn better. Up next, I'm about to introduce one of the best speakers again, called Joyce Homer. Joyce, what reasons, what resources are available? What support is available for young people to meaningfully be involved and engage in GC8? And where can we access this support? Joyce, we are so anxious and ready to hear from you. Thank you.
Thank you very much, Michael, and thank you, colleagues, for having me. I was also privileged to attend the meeting that formed the basis of the feedback session that we are having today. So a lot of the information I'm going to be sharing today in terms of areas to access technical support is based on a large-scale consultation and feedback from the communities themselves. So because we are at the top of the hour, I'm not going to belabor much, but this is a series of conversations, and as we go on, we will identify other avenues of offering TA and how young people can be meaningfully engaged during particular process. So one, the Anglophone Africa Regional Learning Hub, I think Lisa already alluded to this, the Anglophone Africa Regional Learning Hub has certain resources that are earmarked specifically for offering technical assistance to countries. However, these resources can only be acquired with approval from your CCM. So again, it is very important for young people to actively engage with their representatives at the CCM. And we also have a regional network, the IANASO, where the Anglophone Africa Regional Learning Hub is also hosted. We have youth-led networks who have continued to do this work. So this meeting that we are having today is an example where youth-led networks can also step in to offer peer-to-peer support or peer-to-peer capacity strengthening on the GC8 process. So Y+ Global is doing this in collaboration with the Her Voice Fund, and of course under the United Movement, which we all know about. And if you don't know about it, please check out the social media pages. And I think Faith mentioned at the beginning of the session. We also have technical assistance support from partners. Lisa mentioned that the event was attended by Frontline AIDS, Stop TB Partnership, UNAIDS, and other partners that were there. Different partners have allocated specific resources or staff technical time to be able to contribute to this process. The process by itself is going to be a very shorter process compared to what we are used to. So starting from mid-March, hopefully countries will be able to receive their allocation letters. And once this is done, please feel free to reach out to the partners from TB Partnership, Frontline AIDS, and even the development partners, UNAIDS, UNICEF, and colleagues who you've seen on this call. And then there's also aspects of mentorship and peer coaching for effective engagement in GC8. This is an overall overarching theme, and it is very impressive that the East and Southern Africa region actually has a lot of young people in the CCMs. I think Faith and team did a quick mapping on how many representatives we have within the CCM. We have a huge number of above 12, which is a good thing, and compared to other regions, we are doing well. So please take advantage of these platforms, take advantage of these connections, take advantage of the representatives within these particular constituencies. I think Faith will talk about the next steps after this meeting, and you can continue to explore other ways of TA. One question that we've constantly been asked as UNAIDS is whether or not we are continuing to provide the technical support mechanism, the TSM, that we have traditionally done in the past grant cycles of the Global Fund. Unfortunately, this time around, we have not been able to assign those particular funds, but we are working internally to continue looking for resources on how best we can show up for communities and support communities of young people as well in engaging in the GC8 process. Thank you, and back to you.
Thank you so much. That was so good. I'm going to invite Linda to take us into the plenary. We promise you it's going to be short, but again, we thank you for keeping with us until the top of the hour, and we promise you in the next few minutes we'll be done, but we don't want to get done without hearing from you. So over to you, Linda, as we get into the plenary. Thank you.
Wow, thank you so much, Michael. So now I'm going to invite Miranda to take us through the plenary. And please let us keep time. We don't have enough time. Let us keep time so that we should also have a question and answer time. So please let us welcome Miranda. Miranda, it's your turn and over.
Thank you very much, everyone. I would just love to thank the organizers of this session. I think it's a very important session and it's really adding a lot of knowledge to our young people that are on the call. My name is Miranda Ziba. I am the country youth representative in Zambia on the CCM, and I'm really glad to be here. I hope I'm audible enough. But as we have been discussing today, we've really come to realize that we as young people have a lot of work to do, and it is our time to take up this step. As we have heard during all these discussions, they have reminded us that young people are not, we are not just the beneficiaries of the Global Fund, but we are the key partners in shaping the response towards HIV, TB, and malaria. So as we move on into the GC8, our role becomes actually even more important. And so in this plenary session, I would like us to reflect together and just see how we can respond to a few questions as in this meeting. And see what we as the young people are thinking. We have had quite a number of contributions and discussions that we have had in this meeting. And we have also been informed that we have support, just like the previous speaker was telling us, that we are able to access some TA. We have been there has been an emphasis on us focusing on collecting evidence through community-led monitoring. We have had discussions around sustainability and planning for transition. So what is it that we are thinking about now as young people? I would like to just pause now and ask us to just respond to the question, which is the first one, saying what key actions do we plan strengthen our engagement in the GC8? So I would just like to open it up to anyone that would like to come in and respond to this question, just to see what our reflections may have been following the discussion that we have just had. Do we have anyone on the call that would like to just come in and just tell us what their reflection has been in terms of what we as young people are thinking we need to, what step do we think we need to take to strengthen our engagement? I see a hand from Ruth. Okay, it looks like we have lost Ruth. Ruth, if you can hear us, please speak.
Hi, everyone. I love the discussion today, and thanks so much to I Plus Global and the United team for this. Yes, what key action will I take to strengthen youth engagement in GC8? And we're already doing that with our team, and that is taking time to reflect. And I know this session is about reflecting, but also as the country youth reps, we are taking time to sit back and reflect on where are the gaps in terms of our engagement, who is missing in our engagement, and we're already taking necessary steps to strengthen the engagement of young people in GC8. We do not want to make sure that we want to make sure that no one is left behind. And as youth, we are diverse. It's not just people living with HIV or population, but we also want to make sure that we have private sector. And one of our colleagues here talked about sustainability. So we're also trying to make sure we bring the private sector on board to also be able to sustain the work in the future. In case we need probably resources, they're able to come in and support in different engagements as in country, there's no enough resources allocated towards continuous engagement for young people whenever we need it. So yeah, that's it. That is strengthening accountability.
Thank you so much, Rose, for that contribution. It's also good to hear that you are already thinking about how you plan to engage private sector in this discussion. This was among the other key issues that we discussed during the meeting in Kigali, Rwanda, and we are looking forward to see how countries will come in and ensure that they engage private sector, and also to see how much private sector is able to support us during the GC8. So now we have also had another major call for young people to be actively engaged and to move from being just participants. I would like to hear from some of the young people on this call to see what they plan to do in order for them to actively participate and also influence the process of the GC8 as it begins. So what plans do we have as young people, and what support do you think we may need from either this team here online and going forward, and also within our countries? What support do you think we may need as young people in terms of us ensuring that we actively participate and also influence the GC8 process? Over to you, our young.
Miranda, we've lost you.
Okay, are you able to hear me, Linda?
Yes, we're able
Yes.
to hear you, and we're remaining with 3 minutes for us to finish this plenary discussion. So over.
Okay, so looking at time, I think it would be great for us to just combine the two questions on how young people can influence the GC8 process and what steps the civil society can take to strengthen coordination among young people and also within the civil society space itself. Do we have any recommendations that we would like to share that civil society should take to strengthen coordination? And do we have any young people that already have the steps that they want to take to ensure that they influence the GC8 process? If we have any, please feel free to raise your hand or just unmute and speak. All right, so
I see there's a lot of
see
comments in the chat as well.
some response on the chat, and the first
Miranda, you're tripping.
one being that we need to ensure that young people are included in the writing team. Yes, so I will just read a few comments in the chat, and the first one being that we need to ensure that young people are included in the writing team so that they can easily imagine how are we going to be able to. Sorry, that could be the network. But our comment is really emphasizing on the need to ensure that young people are also part of the writing team so that they can easily map their priorities. Another comment is a question which is asking how countries can ensure that young people with disabilities and organizations are meaningfully included in consultations and decision-making processes for the GC8, especially within the country coordinating mechanisms. Here in our country, Zambia, we do organize dialogue meetings where we ensure that every person is involved, including persons with disability. And I'm also hoping that this could be what is happening in other countries. But just to you, George, please, I think what we can just say for now is that we ensure to engage persons with disability during our dialogue sessions and community engagement meetings that we hold in country during the GC8 dialogues as we prepare to start the writing. There is another comment which says they are encouraging governments to come in and support the program and improve the gaps in the youth in the engagements. Yeah, so I think this would be the responses that we have on the chat. I don't know if we have any other new responses or any continue with some of the responses that we have on the chat. I believe I should. So another comment here says increasing negotiation on allocation for young people organizing. And we also have another comment which says we need a consultant with the youth to ensure that the representatives that as representatives share our contributions, they reflect the youth voices. We have another through our youth engagement platforms, we can invite relevant stakeholders like PRs to also give further insights on the writing process. I think the young people are well vested and knowledgeable about what we need to do to ensure that we influence this GC8 process, and they have a number of recommendations for civil society, and also in terms of requesting for technical support. Some are requesting for we have some requesting for consultants, and we see that clearly young people know what they need to do, and this ensure that we are up to speed on what the processes are like and what we need to take, the steps that we need to take. So please just allow me to echo a few key messages from this discussion. One being that young people must move forward, and they need to move from participation to influence, like we have discussed. Another visions as soon as possible as we get into the GC8 process, writing process. We also need to ensure that we use community evidence to advocate for priorities. This is why we have really been emphasizing on this call that the need to use community-led monitoring to gather evidence that we'll be able to use to advocate for our priorities, because if it is not written, it is really difficult to push for it and to see to it that it is actually recognized as a priority. But if you have evidence, it's easier to show that this is where you are speaking from. Another different networks, let us not work in silos as young people. If we are to influence, we need to ensure that we work across collective networks. As young people also, we need to also know that we are not we are not only the future, but we are currently the present. So it is up to us, and nobody is going to come and ensure that our priorities are ahead if we do not come in ourselves. So I see that we still have quite a lot of comments. We will take note of them, and I believe that group and continue with this conversation.
Miranda, we've lost you. I think your network is tripping.
So I just want to hand over to Linda.
Thank you so much, Miranda.
Thank you very much for this opportunity.
Thank you so much, Miranda, and thank you so much for everyone for participating in the comment section, and also for those who raised their hands. Reaching this far, I don't think we'll need a question and answer because some of it was also tackled on the plenary. And also, if you have further questions, please, first of all, scan the QR code for you to join the WhatsApp group. When you join this WhatsApp group, we can always discuss on how best we can engage in the GC8. But also, if you have any other question, we'll be able to help each other. As of now, please scan the QR code for you to join the WhatsApp group. Reaching this far, I would like to thank everyone for actively participating. Yes, we didn't have enough time. We know that it's Friday. Some of you could have been doing other things, but the fact that all of us spared precious time to be here, we don't take it for granted. I would like to hand it over to Faith, but as Faith is coming, I would also like to thank the organizers, Joyce, Angela, Faith, Lisa. Thank you so much, and thank you so much to everyone. Over to you, Faith.
Thank you, Linda. I feel like now I'm being put on the spotlight to be the one who is holding people's time. But other than that, thank you very much for joining this first ever session today, and thank you to all our panelists. We really appreciate the time that you've afforded to us and to share the knowledge that you have just done so. And to all the young people in the call today, I really hope that you will use this particular information to ensure that you engage in the Global Fund processes and don't just ascribe Global Fund processes to your youth representatives. You have the right to hold them accountable and ask them what is really happening when it comes to Global Fund processes in our country, because you've been selected as our youth representative in the CCM. You also have the right to actually link up with them and ask them that you would want to observe one of the CCM meetings, and they can communicate that particular information with their secretariat, and that arrangement will be made for you to observe, to come in as an observer, so that you also know the conversations that are happening in the room that have to do with your priorities and your health and your needs. As our next steps from this particular meeting, as we've already alluded at the beginning of the call, this is not the first of it, and it's not the last of it, but this was the first one. We are planning another more technical one, not just the feedback session, where then speakers like Angela can unpack some of the documents that they have shared with us, because they can get a bit technical and a bit tricky. And if it's your first time interfacing with those kind of documents, you can get a bit demotivated to even go ahead and read or engage in whatever you're being asked to engage in. So a little bit of unpacking and guidance on how to actually use those documents to your benefit would be critical. Hence why we are asking you to join the WhatsApp group, which unfortunately some of the CCM members did not join today, but you get to meet them in that particular WhatsApp group. And we are planning to also have sort of like a regional advocacy roadmap that will then use to hold all the CCM youth representatives accountable to say, in Botswana, Faith, you said this is how you're going to engage young people in the Global Fund processes in your country. And these are the targets that you had set for yourself. Um, have you invited young people to your constituency dialogues? Have you ensured that the priorities that young people raised during the constituency dialogue have been fed into the grant applications for your country? And engagement doesn't stop at the grant applications. It goes through up until the last bit of it, where you get to evaluate if the country did well with their implementation of the grant. You'd um, I had hoped that Angela would actually share some of the nitty-gritties that go around the roadmap of Global Fund processes. The first process is the grant allocation letters that are coming to countries this particular month. Um, and then from there, you go into the fund request development. And I saw a comment in the chat box saying that the CCM Secretariat and some civil society members who are technically savvy are the ones who are best placed to do the writing. That is not true. You also can engage in the process, because if you are going to reserve it for only those people, that's how you are leaving room for your priorities to be left out in the grant applications. And then from there, the funding goes then to the applications go to the TRP, who review it, and then after review, if there are comments, they bring it back to the country, and you need to also be part of that process to see what comments and questions, feedback that came from the TRP and what needs to be addressed. And if it has to do with your priorities, you see how best to advocate for them so that you don't totally lose out. From there, you go into the grant making and grant submission to the grant application committee. And then once successful, the countries can then move into the implementation. And it's very important also to encourage your CCM youth representatives to ensure that they sit in other committees within the CCM, committees like the oversight committee, so that they also get an opportunity to monitor how the grant is being implemented at country level. And even when they are doing the closeout for the grant, it's very important for you to engage to see if the country implemented the grant that was given to them with fidelity, they've used all the funds. Because then, if the funds were not used, but the gaps are still there, you then have sort of like a risk of when coming back to Global Fund to apply for the next cycle, you get less money, yet you have a lot to do. I don't want to talk much more. We'll meet on other platforms. As I've already mentioned, we are already planning a second one, which will probably come at the end of this month or beginning of April, and we hope to see you there all. Please, please, please join the WhatsApp group. I've shared the link in the chat box as well. Thank you very much, and over to you, Linda.
Thank you so much, Faith. Now I don't know what to say since you've already offered the closing remarks. But yeah, thank you so much, everyone, for joining. Please make sure that you join the WhatsApp group so that for further communication, we'll be engaging there. Having reached this far, I'm wishing everyone a nice weekend. Let us take care of our mental health as well. Until next time, bye.
Bye. Thank you.
Bye. Thank you very much.
Thank you. Goodbye. Thanks for having us.
Bye.